Hello and welcome everyone. Negative and positive things will happen in your life no matter how positive or negative minded you are. So you must learn to be grateful whenever good things happen to you, and also be able to keep your head up and continue pressing toward whenever something bad transpires in your life. It doesn't help to stress yourself over things you cannot control, because chronic stressors can prove detrimental to your health. Hi, I'm Stephanie Anderson, and welcome to Main Health. And today I am going to share with you what I believe to be true regarding stress and its effect on the body. Now, here is my disclaimer. I by no means represent myself as a medical doctor, and this information is not intended to diagnose or treat an illness. However, I am certified as a natural health professional and promote more naturopathic ideations. As a practicing trichologist and natural health professional, one of my most effective tools in my arsenal is the consultation. It's my first line of defense, and the consultation actually allows me the opportunity to visit with my client, asking in-depth and strategic questions that I hope will assist me in identifying the causation of their issues, which then helps me to develop a treatment plan of care for them. Now, more times than not, one common denominator in many health-related issues, including hair loss, begin with stress. Scientists have known for years that there's a connection between long-term stress and heart attacks. But until recently, the reasons were imperfectly understood. What is stress, you may ask? Stress is the body's reaction to any changes that require an adjustment or response. The body reacts to these changes with physical, mental, and emotional responses. Stress is a normal part of life. You can experience stress from your environment, your body, and even your thoughts. Now, this is how your body reacts on stressors, aside from just the heart. The Mayo Clinic explains that severe stress can negatively impact health in many other ways. Stress causes effects on the body such as headaches, muscle tension, fatigue, muscle pain, chest pain, upset stomach, and insomnia. It can also affect your mood by causing anxiety from various stressors. So what are stressors? Well, a stressor is any event or circumstance that causes stress. The truth is, a stressor as much doesn't necessarily cause stress, but our perception of that event, the meaning that we attach to it, and the way we react to it. It leads to symptoms or disease of stress. Now, shortly, I will share with you how stress affects different body systems. But first, allow me to outline different types of stressors. There are biological stressors, which are any illness or disease, disabilities, or injuries. We have environmental stressors, which can include poverty, overcrowding, even natural disasters. Now, as of the taping of this broadcast, we are in hurricane season. And most recently, Hurricane Dorian has left devastation in its path, definitely causing mayhem and stress to all those affected. Then we have cognitive stressors, or the inability to solve problems, coming up with creative projects. And then we have life-changing stressors, which could be a death of a loved one, a divorce, or trouble among family or friends. Now, let's identify the various types of stress. We have acute stress, which is a reaction to an immediate threat, most commonly referred to as, I'm sure you've heard it, the fight or flight response. Now, this threat can be any situation that is experienced, even subconsciously or falsely, as a danger. Now, it's the perception. Common acute stressors include noise, crowding, or even perhaps hunger. Chronic stress frequently, however, the modern life poses ongoing stressful situations that are not short-lived, and the urge to act, like the fight or flight. These must be suppressed. Stress then becomes chronic. Now, common chronic stressors include ongoing highly pressured work, long-term relationship problems, loneliness, and persistent financial worries. Eustress. Now, eustress is the definition of moderate or normal psychological stress interpreted as being beneficial for the experience. In layman's terms, it's the good kind of stress because something pleasing will result at the end of the stressful situation. For example, planning a wedding or planning a party or completing your final exam prior to graduation. Now, on the other end of the stress spectrum, we have distress. Distress is the extreme anxiety, sorrow, or pain. In other words, it's a displeasing kind of stress. It is the bad kind of stress. Distress causes the most harm to the body, and one that I encounter more often in my treatment center practice. Examples of distress are death of a loved one, natural disasters like floods, earthquakes, and financial problems. Now, your body's response to stress, in this example, I will share with you how stress affects the cerebral cortex, which perceives stressors, the thalamus, the hypothalamus, pituitary, and adrenal glands. In an episode of chronic stress, your pituitary hormones in the bloodstream stimulates the outer part of the adrenal gland to release the stress hormone cortisol. The sympathetic nervous system, or the SNS, releases the stress hormones, epinephrine, norepinephrine, from the nerve endings in the inner part of the adrenal glands. Now imagine this. You're standing in front of a boardroom packed with executives, and you are the presenter. And you go to your laptop to pull up your files for your presentation, only to find out they've been corrupted. Can you imagine the sense of dread? There is a name for this psychological response to prolonged stress that people endure. It's the same response that I'd imagine that has been around since the beginning of mankind. It's just as prevalent, if not more, today. The name for it is general adaptation syndrome, and it was discovered by General Hans Selye very many years ago. Now, there are 3 stages to this type of stress. The alarm stage, which occurs when a person recognizes the threat and mobilizes resources. There's the resistance stage, and it occurs when resistance is prolonged. And then thirdly, we have the exhaustion stage. Now, it occurs when your body's resources are depleted. So now that you understand that, let me focus on stress and illnesses and identify 2 key components. We have psychosomatic disease, which is defined as physical ailments with a genuine organic basis that are caused in part by psychological factors, especially emotional distress. For example, hypertension, ulcers, eczema, and migraine headaches. Now, I've been visiting with various clients who have shared experience of visiting the ER with chest pains or maybe even shortness of breath, but not experiencing any type of cardiovascular or physical disease or episodes, but they're caused by stress. Then you have emotional problems like anger, panic, fatigue, sleep disorders, depression, suicide, and even suicide attempts. Were you aware that stress weakens the immune system? Now, stress weakens the immune system by diverting the energy required for its functioning to deal with the stress. Cortisol, a hormone released during stressful situations, affects the immune system greatly by preventing the production of cytokines. Now, during chronic stress, cortisol is overproduced, causing fewer receptors to be produced on immune cells so that inflammation cannot be ended. Cardiovascular issues are very common in my family. One of the ways that I have tried to maintain my health is by, you guessed it, minimizing my stress. Studies have also showed a correlation between stress and chronic heart diseases. Stress has been known to clog the vessels that nourish the heart muscles. Chronic stress causes increase in the level of lipids, and blood tends to become stickier, which increases the likelihood of an artery clogging blood clot. As many of you know, that hypertension is a silent killer. Stress can also negatively impact high blood pressure. Essential hypertension is a condition in which there is chronic high blood pressure, usually with no biological causes. Anyone that shows an exaggerated response to a variety of stimuli is more likely to develop hypertension. As you may imagine, blood sugar or diabetes is also affected by stress. Now, cortisol causes increase in blood sugar levels to help boost energy. Now, this may be compounded by unhealthy eating habits. With a number of cancer diagnoses increasing, I want to quickly address stress and cancer. The hormones released during stress response can alter the numbers and types of immune cells, such as T cells produced by the body, and also increase inflammation. Since immunity and inflammation affect cancer, stress is extrapolated to affect cancer on this basis. Headaches can be brought on by an intense constriction of blood vessels supplied to the brain. Now, this is followed by distension to allow blood to flow back to the brain. These distended blood vessels push on the nerve, resulting in headaches. And as you may know, asthma is a chronic inflammatory disease of the airways in the lungs. The airways become constricted, making it difficult to empty the lungs and therefore reducing the amount of air that can be inhaled. There are also psychological factors such as stressful situations, negative family environment, emotional arousal that can bring on attacks as well. IBS, or irritable bowel syndrome, can also be exacerbated by stress. Now, it has been suggested that there occurs a disturbance in the gut-brain axis. The large intestine becomes irritated and its muscular contractions are spastic, rather than smooth and wave-like. The abdomen is bloated, and the sufferer experiences cramping and alternating periods of constipation and diarrhea. There can also be occupational stressors, similar to the scenario that I mentioned earlier. Now, living in San Antonio, Texas, also known as Military City, USA, I'm also familiar with PTSD, or post-traumatic stress disorder. Having the opportunity to service our active and retired military service members have given me another level of understanding of this particular type of stress. PTSD is a disorder that allows exposure to a life-threatening or other extreme event that cause feelings of horror or helplessness. It can also be a result of sexual assault or rape, robbery or aggravated assault, and survivors of disasters. Now, how stress affects the individual body systems are as follows. The musculoskeletal system. When the body is stressed, muscles tense up. Muscle tension is almost a reflex reaction to stress. It's the body's way of guarding against injury and pain. With sudden onset, the muscle tenses up all at once and then release all their tension when the stress passes. Chronic stress causes the muscles in the body to be in a more or less constant state of guardedness. When muscles are taut and tense for long periods of time, this may trigger other reactions of the body and even promote stress-related disorders. The respiratory system. Stress makes breathing harder. An acute stress, such as the death of a loved one, can trigger asthmatic attacks. Stress can cause rapid breathing or hyperventilation that can bring on a panic attack in someone prone to panic attacks. Working with a psychologist to develop relaxation and breathing strategies can help. Cardiovascular system. Acute stress that is momentary, such as meeting deadlines, being stuck in traffic, or suddenly slamming on the brakes to avoid an accident, causes an increase in heart rate and stronger contractions of the heart muscle, with stress hormones acting as messengers for these effects. Other effects include vasodilation, increased cardiac output, increased blood pressure, increasing the risk for hypertension. Now, postmenopausal women are at a greater risk for the effects of stress of heart disease. Next, we have the endocrine system. When the body is stressed, the hypothalamus, the pituitary gland, and the process is started to epinephrine from the adrenal medulla and cortisol from the adrenal cortex, sometimes called stress hormones. When epinephrine and cortisol are released, the liver produces more glucose that will give energy for fight or flight in an emergency. If this extra glucose produced is not utilized by the tissue, it results in a type 2 diabetes. Studies show that if a person learns how to manage stress, he or she can control their blood sugar levels, sometimes as nearly as much as with medication. Gastrointestinal system. Eating much during stress causes heartburn or acid reflux or GERD. When a person is stressed, The brain becomes more alert to sensations in the stomach, resulting in pain and nausea. Chronic stress causes ulcers. Stress can also affect digestion and what nutrients the intestine absorbs. It can also affect how fast food moves through the body, resulting in diarrhea and constipation. The nervous system. When the body is stressed, the sympathetic nervous system, or the SNS, generates what is known as, you guessed it, the fight or flight response. The body shifts all its energy resources towards fighting off a life threat or fleeing from an enemy. The SNS signals the adrenal cortex to release cortisol. The SNS response is fairly sudden in order to prepare the body to respond to an emergency situation or acute stress. Once the crisis is over, the body usually returns to the pre-emergency situation or the unstressed state. The male reproductive system. In the male reproductive system, stress causes the body to release the hormone of cortisol, which is produced by the adrenal gland. Excess cortisol can affect the normal biochemical functioning of the male reproductive system. Now, chronic stress can affect testosterone production, sperm production, and maturation, or even called erectile dysfunction or impotence. Also, when stress affects the immune system, the body can become vulnerable to infection in the male anatomy. Infections to the testes, prostate gland, and urethra can affect normal male reproductive functioning. Now, within the female reproductive system, stress results in absence or irregular menstrual cycles, more painful periods, and changes in the length of cycles. Stress may make premenstrual symptoms worse or more difficult to cope with these symptoms. Some of these symptoms include cramping, fluid retention, and bloating, negative moods or feeling irritable and blue, and sometimes mood swings. Menopause can be a stressor in and for itself. Some of the symptoms, especially hot flashes, can be difficult to cope with. Stress, distraction, and fatigue may reduce desire sexually, especially when women are simultaneously caring for young children or ill family members. Bottom line, as you can see, stress, if not managed, can be detrimental to your health and overall well-being. It behooves each and every one of us to be more proactive about our health. Remember, as a trichologist, I am not a medical doctor. However, I am a natural health professional who is proactive in learning more in order to live a better, healthier way of life and share this great information with the masses. Now, if you're interested in learning more about natural health, visit naturalhealthprotraining.com. Now, that is an awesome platform and with lots of free information. Again, thank you for joining me here today in Maine Health. This is Stephanie Anderson. Feel free to contact me at info@stephaniellanderson.com. Until next time, take care, be blessed. Bye-bye.